A 74-year-old man sat across from me in my office, his hands folded tightly in his lap. He wasn't trembling from illness, he wasn't in pain. But there was something heavy in his eyes, a kind of quiet shame that I've come to recognize after decades in this field. He looked at me and said, "Doctor, I didn't know. I've been hurting myself for years, and I didn't even know it." And the thing is, he wasn't doing anything extreme. He was doing what millions of men do in private, every single day, without ever realizing that the way he was going about it was silently affecting his health, his mood, and his sense of self. That moment stayed with me, because he is not alone, not even close. I'm Dr. Daniel, and welcome to Dr. Daniel Brooks. Advanced Health, the channel where we talk openly about the things most doctors don't have time to cover in a 10-minute appointment. I've spent over 3 decades working with older men on issues of neurological health, sexual wellness, and the kinds of deeply personal concerns that rarely get discussed at the dinner table or even in the exam room. Today, we're going to change that. Because if you are a man over 60, or you love one, what I'm about to share could genuinely improve your quality of life in ways you might not expect. Now, I want to speak to you directly for a moment, man to man, doctor to patient. If you've noticed that things are different than they used to be, that your body doesn't respond the way it once did, that intimacy feels more complicated, or that you carry a quiet uncertainty about whether a certain part of your life is simply over. I want you to hear this. You are not broken. You are not alone. And this conversation is long overdue. What I'm about to share isn't scandalous or inappropriate. It is medical. It is real. And it could genuinely change how you experience the years ahead. So take a breath, stay with me, and let's talk honestly. Today I'm sharing 5 critical truths about masturbation in older men, things I call secrets, not because they're hidden in some medical vault, but because the culture we grew up in never gave us permission to talk about them. These are truths shaped by real patient experiences, backed by science, and delivered with the one thing every man in my office deserves: respect. And before we dive in, if this kind of honest, age-specific health content speaks to you, go ahead and hit that subscribe button and turn on the bell notification. I create this content specifically for men like you, and I don't want you to miss a single video. Now let's get into it. The first truth is one I wish I could hand to every man who walks into my office with that same quiet panic I described a moment ago. Your erection is no longer the whole story. And that is not failure. That is evolution. I remember a gentleman 72 years old who sat down across from me with a look I've seen many times, frustrated, ashamed, confused. He said, "Doc, I can't do what I used to do. Does that mean I'm no longer a man?" And I want you to understand that question broke my heart, not because it was unusual, but because it was so painfully common. So many men walk through life after 60, quietly panicking about changes they were never prepared for. They notice things aren't as firm, as fast, or as reliable as they once were, and their first conclusion is, something is wrong with me. But here's what the science actually tells us. As we age, our bodies go through natural and predictable shifts. Blood flow becomes more deliberate. Testosterone levels fluctuate. Nerve conduction slows slightly. What once felt automatic now requires patience and intentionality. And this does not mean your sexuality is broken. In fact, research in sexual gerontology, the study of sexuality in older adults, consistently shows that men who adapt to these changes rather than resist them report higher levels of sexual satisfaction and emotional well-being than those who measure themselves against a standard that no longer applies. Think about it this way. Your body at 70 is not supposed to function like your body at 25. Your knees aren't. Your digestion isn't. Your sleep isn't. So why would we expect one single aspect of your biology to be frozen in time? What matters now is not performance, it's presence, not pressure, it's permission. And once you stop chasing what was and start exploring what is, you open a door to a new kind of intimacy, one rooted in patience, in curiosity, and in genuine self-respect. That shift alone has transformed the lives of many of my patients. If this is resonating with you, drop the number 1 in the comments below. I'd love to know you're here and listening. Now, the second truth takes us somewhere a little deeper, because what I've come to understand over 3 decades is that this isn't just a physical act. For older men especially, masturbation is emotional, it's neurological, and understanding that changes everything. Not long ago, I sat with a retired veteran. Let's call him Howard, in his late 70s. He wasn't there because of a pressing medical emergency. He came in because, in his own words, I just don't feel anything anymore, not physically, just in general. At first, I assumed we were dealing with something hormonal, but the more we talked, the clearer the picture became. Howard had developed a nightly habit that had nothing to do with desire. It had become his way of managing grief, loneliness, and the kind of quiet anxiety that settles in when the world gets too still. He hadn't named it that, he didn't even realize it, but his body was reaching for calm the only way it knew how. This is not unusual. After orgasm, the brain releases a powerful cocktail of neurochemicals: dopamine, which creates feelings of reward and pleasure; serotonin, which regulates mood and emotional stability; and oxytocin, the so-called bonding hormone, which promotes feelings of connection and calm. For men living alone or men carrying silent emotional weight, this physiological response can become a form of self-regulation. And that, in itself, is not wrong. But when it happens without awareness, when the act becomes hollow and mechanical, it can slowly sever you from the deeper emotional connection it once provided. We were raised to keep emotions buried, to push through, to be strong and silent. So when the only moment you truly let go is in private, that moment carries more weight than you might realize. The practical takeaway here is this: bring intention to this part of your life. Slow down. Be present. Ask yourself what you're actually reaching for. Is it pleasure, peace, connection? When you answer that honestly, you can begin to meet those needs in ways that actually nourish you. And that might include self-touch, or it might include other forms of emotional self-care that you've been neglecting. The point is awareness, because mindfulness in this area of your life is a form of genuine health care. Now, the third secret is one I find myself explaining to patients more often than almost any other, and it's this: the use it or lose it rule is real, but almost every man I've met has misunderstood it. Let me tell you about Roy. He was 74, widowed, and had recently started dating again after more than a decade alone. When he came to see me, he wasn't excited about this new chapter. He was devastated. "I finally found someone," he said, "but my body doesn't work the way I need it to." The heartbreak in his voice was real. He assumed something was broken. He assumed it was too late. But what Roy didn't know, and what most older men are never told, is that what he was experiencing wasn't dysfunction, it was disuse. Here is the medical reality. The erectile tissue in your body responds to activity. Just like muscle requires regular use to maintain its strength and elasticity, the tissues and blood vessels involved in sexual function require regular stimulation to stay healthy. When there's no stimulation over an extended period, those tissues can begin to lose elasticity. Nerve sensitivity can decrease. Blood flow patterns change. A 2008 study published in the American Journal of Medicine found that men who reported higher frequency of sexual activity in midlife had significantly lower rates of erectile dysfunction as they aged. The conclusion was clear: regular, healthy sexual activity, including masturbation, acts as a form of pelvic floor exercise and vascular maintenance. Roy hadn't abandoned this part of himself out of laziness. He'd let it go because he thought it no longer mattered without a partner. That belief is both common and harmful. Your sexual health is your health, full stop. It doesn't require a relationship to be worth maintaining. With gentle, consistent, intentional stimulation, Roy's body began to respond again. It wasn't immediate, but with patience, things slowly came back to life, and with them, a piece of his confidence that he hadn't felt in years. The actionable advice here is straightforward. Don't wait for the right moment to reclaim this aspect of your well-being. Low-pressure, consistent engagement with your own body is one of the simplest and most effective ways to maintain vascular health, tissue elasticity, and hormonal balance in your later years. And if you have concerns about erectile function, please speak with your doctor. There are more options available today than ever before, and you deserve access to all of them. The fourth secret is one that makes a lot of older men uncomfortable. Not because it's inappropriate to discuss, but because many of them recognize themselves in it. And that recognition can be the first step toward something better. Ernest was 68, a widower, and had been struggling with what he described as a disconnect. He still engaged in self-stimulation regularly, but something felt hollow about it. "Nothing really reaches me anymore," he told me. As we talked, it became clear that his nightly habit had become tightly tied to pornography, something he had turned to for comfort and stimulation after the loss of his wife. It had crept in gradually, quietly, and over time it had begun to numb him. Here is what the neuroscience tells us. Pornography triggers an unnaturally high surge of dopamine in the brain, the same reward chemical we discussed earlier. Over time, with repeated exposure, the brain adapts by reducing its sensitivity to that dopamine signal. This is called downregulation. And what it means in practice is that the brain begins to require more intense, more novel stimulation to feel the same level of reward. The consequence, especially in older men, whose brains are already somewhat less neuroplastic than they were at 30, is that real touch, real intimacy, and even the imagination can start to feel flat and unrewarding by comparison. Ernest described it beautifully, and I think his words will resonate with some of you. It's like being in a room with all the lights on, but no windows. He could see, he could function, but he couldn't connect. What we worked on together, slowly and without judgment, was a gradual reduction of that screen dependency, paired with a reconnection to his own body, his own breath, and his own inner world. Within weeks, his sensitivity began to return. His imagination, which had gone quiet, started to come alive again. He told me it was like coming back to himself after a long time away. If any part of that story sounds familiar, please hear me say this. There is no shame in it. The brain is remarkably adaptable, and with patience, it can recalibrate. The first step is simply awareness. The second is making a choice to step back from high-intensity stimulation and allow your natural responses to resurface. And if you need support with this, and whether from a doctor, a therapist, or a men's health specialist, please reach out. You deserve real, embodied pleasure. Don't let a screen quietly take that from you. And now we come to the fifth secret, the one that, in many ways, ties all the others together. Because after everything we've discussed, the evolution of the body, the emotional weight of this act, the risks of disuse and overstimulation, what I most want you to take away is this. Masturbation, practiced with intention and self-respect, can be one of the most meaningful acts of self-care available to you at this stage of life. Walter was 75, soft-spoken, and enormously polite. He came in for a routine checkup, and toward the very end of the visit, he hesitated, then asked quietly, "Doctor, is it still okay for me to touch myself at my age?" That question stopped me, not because it was unusual, but because of the way he asked it, as if he was confessing to something he should be ashamed of, as if pleasure itself had an expiration date. Walter had lost his wife 6 years earlier. After she passed, he shut down that entire part of himself. "I thought it was inappropriate," he said. "I didn't think I was allowed to still be that kind of man." That belief, that desire must end with loss, that older men have no right to pleasure, that wanting to feel alive is somehow indecent, that belief is a lie, and it is a lie that causes real, measurable harm. When Walter slowly, gently, began to reconnect with himself, without pressure, without agenda, simply with presence, something shifted. His mood lifted, his sleep improved. He told me he smiled more. He wasn't chasing youth. He wasn't trying to be 40 again. He was simply reclaiming his dignity. And that is exactly what this can be, not an escape, but a return. Not something to hide from, but something to approach with the same care and intentionality you would bring to any other aspect of your health. The science is clear. Regular, mindful sexual activity in older age supports pelvic floor health, promotes healthy prostate function by facilitating regular fluid release, reduces cortisol levels, improves sleep quality, and maintains a connection to one's own body and sense of identity. These are not small benefits. These are pillars of healthy aging. So let me close with this. If you've made it through this entire conversation, thank you. Not just for watching, but for having the courage to engage with a topic that most men your age were never given permission to explore openly. That courage matters. It is part of what it means to age with strength and self-awareness. Your erection is not your worth. Your body's changes are not your failures. The quiet part of you that still wants to feel alive, that part is not shameful. It is human. And it deserves your attention, your patience, and your respect. Wherever you are in your journey, single or partnered, just beginning again or simply trying to understand yourself better, I hope these 5 truths have given you something real to hold on to. Because desire doesn't retire. It softens, it shifts, but it never fully disappears. And when you learn to meet your body where it is, rather than where it used to be, you discover something powerful. You are still whole, you are still worthy, and there is still so much life ahead. If this video spoke to you, I want to hear from you. Leave a comment below and tell me which of these 5 truths hit closest to home. Your words help me understand what you need, and they help other men who are scrolling through the comments know that they are not alone in what they're feeling. And if you haven't subscribed yet, please do, and share this video with a man in your life who might need to hear it. You never know how much a single, honest conversation can change someone's day, or their year, or the way they see themselves entirely. I'm Dr. Daniel, and I'll see you in the next video. Keep taking care of yourself, because you are absolutely worth it.